Dear friends, welcome to Know Thyself YouTube Channel. Good morning. Hope you are all staying safe and keeping well. I sincerely thank all of you who have subscribed to this channel and follow the channel. If you find the contents of the videos uploaded in this channel useful, please subscribe to this channel and click the notification or the bell icon so that you can be notified when a video is uploaded. Kindly share the videos with others or on the internet. In the last episode of Know Your Mind segment, we considered the second behavioral disorder, namely the opposition defiant disorder, in detail. In this episode, we analyze the third behavioral disorder, namely the conduct disorder or CD. Conduct disorder is a behavioral disorder that involves a group of behavioral and emotional problems that usually begins during childhood or adolescence. Children and adolescents with conduct disorder have difficulty in behaving in a socially acceptable way. They display a repetitive pattern of aggressive, destructive, and deceitful behaviors that can violate other people's rights and persistently not follow age-appropriate rules and social norms. Thus, conduct disorder is characterized by consistent pattern of aggressive behaviors that can harm the well-being of others. Therefore, it is important that occasional rebellious behavior during childhood and adolescence are not construed as conduct disorder. The symptoms that lead to the diagnosis of conduct disorder demonstrate a disruptive and repetitive pattern. It makes the affected person to behave in extremely troubling, socially unacceptable, delinquent, and illegal ways. However, those with conduct disorder feel justified in their actions and show little empathy for their victims. Conduct disorder can have a significant impact on the affected person's academic, social, and home life. It can develop both in children and adolescents, though it can also persist in adulthood and develop into a similar condition known as antisocial personality disorder, which can make it difficult for them to keep their job, maintain relationships, and prone them to dangerous and illegal behavior. Often, persons suffering from conduct disorder may appear tough and confident, but in fact, they feel insecure and use aggressive behavior to hide their insecurity. Children and adolescents suffering from conduct disorder can be perceived and labeled as bad or delinquent without being aware that they are living with a mental illness. Symptoms of conduct disorder are categorized into 5 groups based on 4 types of behaviors associated with conduct disorder, namely aggressive behavior, destructive behavior, deceitful behavior, law-violating behavior, and the 5th category includes some other common symptoms of conduct disorders. Let us briefly consider each. First, symptoms displaying aggressive behavior include bullying behavior, physical violence, attacking others, using a weapon, verbal fights, intimidating behavior, forcing someone into sexual activity, rape or molestation, blaming others for their own behavior, and cruelty towards animals. Second, symptoms displaying destructive behavior include intentionally setting fires, destroying others' property, vandalizing, and arson. Third, symptoms displaying deceitful behavior include lying to get a favor, hiding truth to avoid responsibilities, stealing from other people, shoplifting, breaking into houses or businesses, delinquent behavior, and tricking others. Fourth, symptoms displaying law violating behavior include breaking rules without clear reason, not attending school, running away from home, playing pranks, mischief mongering, disobeying parents or authority figures, and very early sexual activity. Fifth, other common symptoms of conduct disorder include heavy alcohol drinking, heavy substance abuse, engaging in frequent and risky sex, becoming easily frustrated, making no effort to change the aggressive behavior, not showing remorse for bad actions, and difficulty in making and maintaining friendships. Some mental health professionals speak of three types of conduct disorder based on the age at which the symptoms of conduct disorder begin. First, childhood onset. It occurs when the symptoms of conduct disorder appear before a person is 10 years old. Second, adolescent onset. It occurs when the symptoms of conduct disorder appear during the teen years. And third, unspecified onset. It means that the age at which the symptoms of conduct disorder first occurs is not known. Depending on the intensity of the above mentioned symptoms, conduct disorders are classified as mild, moderate, and severe. When the symptoms are mild, little to no problem is displayed, and the conduct problems are relatively minor and may include issues such as lying, not going to school, and staying out after dark without parental permission. When symptoms are moderate, numerous conduct problems are displayed, such as vandalism and stealing, which have a greater impact on others. When symptoms are severe, conduct problems that can cause considerable harm to others, such as rape, use of weapon, and housebreaking, are displayed. Research indicates that genetic, environmental, and temperamental factors may contribute to the development of conduct disorders. First, genetic factors of conduct disorder consist in family history of conduct disorder or mental illness, and children inheriting personality traits commonly associated with conduct disorder from their parents or other family members. It also includes damage to the frontal lobe of the brain, whether it is inherited or caused due to an injury. Frontal lobe of the brain regulates essential cognitive skills such as problem solving, memory, and emotional expression. Damage to it can cause, among other things, lack of impulse control, a reduced ability to plan future actions, and a decreased ability to learn from past negative experiences, from which many symptoms of conduct disorder originate. Second, environmental factors include child abuse, dysfunctional family, parents with alcoholism or substance abuse problems, traumatic experiences, child neglect, past school failure, and social problems such as poverty, poor living conditions, unhealthy urban situation, lack of education, and the like. Thus, children or adolescents that come from dysfunctional, disadvantaged, and disorganized family situations may have greater risk of developing conduct disorder. Third, temperamental factors such as having a difficult temperament, having a moody or depressed nature, tendency to be fearful and anxious, and being impatient and angry can contribute to the development of conduct disorder in children and adolescents. The symptoms appear between middle childhood and middle adolescence, that is, between ages 8 to 16. Although that is the most common trend, conduct disorder symptoms can also occasionally emerge in children as young as 3 years old and adolescents older than 16 years old. It is common among boys than in girls. Studies indicate that the rate of conduct disorder in boys ranges from 6 to 16%, while the rate among girls ranges from 2 to 9%. Conduct disorder occurs in around 4% of the population, although the prevalence estimates range from 2 to 10%, and the condition becomes more prevalent in adolescents. Early diagnosis and treatment can produce the best outcome. Treatment includes therapy, medication, or both. In the next episode, we begin our analysis of personality disorders. Thank you for watching this video. Stay blessed until we see you again with another video.